The patient has taken, like us also, we also take medicine when we feel any disturbance like cold, cough, sore throat, fever, joint pain, acidity, gas, vertigo, migraine. We are start taking medicine what we understand. All these medicine are being used unscientifically. But you may counter me, you may cross me, that after taking medicine, I feel very better. So, I want to make you remember Master James Tyler Kent, the famous instruction, famous suggestion, and everybody should note it down. You may be in homeopath, you may Ayurveda, you may allopath, or any therapeutic system. Everybody should know that Kent was a renowned allopathic physician. After that, he was converted homeopath. But his observation is very important for the physician of any therapeutic system, any. Again, I am telling, the instruction of James Tyler Kent is useful for every individual, including physician, physician of any therapeutic system, and also layman. As because layman very much interested for taking medicine, and they are keeping so many medicines. Their room is also a, what like this, the dispenser. Some laymen also practicing medicine. This is for fever, like paracetamol. This is for acidity, Pendi or like Gelusil or like this. And also that very layman also keeping homeopathy medicine, Nux vomica for indigestion, Carbobase for acidity, Belladonna for fever, headache like this, and what called the Raulfia for, I think so, hypertension. All this medicine they are keeping and taking themselves and forced to their offspring, their family member, their relatives. So, laymen are very dangerous. Little learning is a dangerous thing. Note this point, please. Little learning is a dangerous thing, and laymen are the most dangerous one. All these laymen, all over the world, they are taking medicine as they according to their knowledge, and that very knowledge is little learning, and that is little learning is very dangerous thing. Every layman should remember this. You don't, if this unscientific practice should be rejected. Again, all these unscientific procedure of taking medicine create trauma. One of my theses on post-trauma syndrome. When time will permit, today or tomorrow or day after tomorrow, I must show. And it is in the, also in the, my group, it is given those who are not joined in the group created by Dr. Gautam Karmakar and also created by real homeopathic go back. I must request everybody to be with all these two groups. Everything will be in two groups. Everybody should follow my instruction, as because I have doing a lot, more than 38 years with this. So please forgive all those things, bad practice, unscientific practice, your unscientific practice. You have, or the newcomer means the next generation have to suffer. due to your unscientific practice of taking medicine for any problem what you are taking. Even my student also, they are also taking like this, but they demand their real homeopath. They also prescribe now also. I know very well. They prescribe Lycopodium lachesis. I feel pain with them. They do not know about Lycopodium. They do not know about Carbobase. So according to their knowledge, they are using. It is very painful to me. You please forgive all these unscientific bad practice. Because if you do all these things, then you will be considered as criminal. You are the criminal. As because you are trying day by day. You are not following classical homeopathy. You are not following real homeopathy. You are following your own homeopathy. So I must tell you, you are the criminal in my eye, in my consideration. To do the best according you think. So today's coronavirus is the product of unscientific medicine practice. As because this unscientific practice create trauma in an individual. Very easy to understand. If someone injure my head by hitting there with something, I must fall down. I must lose my consciousness. Like this unscientific medicinal practice create trauma in an individual, and this trauma create immunodeficiency. Again, I am using this term, and now I am telling in general language. If someone is taking medicine regularly, unscientifically, without having any proper knowledge, that medicine will create trauma. That very trauma create immunodeficiency. I think everybody clear with this very medicinal term. Immunodeficiency means you may be the victim of any infectious or non-infectious disease anytime very easily. That is called immunodeficiency. Immunodeficiency create in the individual the good environment, better to say the best environment in an individual. Again I am telling, the unscientific medicinal practice create trauma in an individual. That trauma create the most suitable environment in an individual. That very suitable individual, any infection may propagate in any time, very busy, very easily, very beautifully. One of the example is coronavirus. Coronavirus is not propagating in everybody. I have mentioned it previously. What I have told? I have told patient of COVID-19 are three types. One is symptomless but infected. Another is with symptom very simple. Another with incomplicated condition. Because the most complicated condition, it means the immunity of the individual is in the lowest level, and the symptomless infected individual, they are of higher immunity level, and the middle one, the COVID-19 patient with simple symptom, their immunity is between the both. So it is, I think it is clear, very much clear with everybody that the unscientific practice of medicine with allopathy, with classical homeopathy, with Ayurveda, with Unani, maybe anything, create trauma. Why I am telling this? Am I have right to say this? Yes, as because Master Hahnemann, Samuel Hahnemann, Master James Taylor Kent very clearly mentioned. The Master Hahnemann, Samuel Hahnemann has mentioned it in first aphorism. What it is? The physician, note it down, the physician, not allopath, not homeopath, not Ayurveda, not Unani. The physician. The physician's high and only mission is to restore the sick. Please again note it down, the sick. Sick, not patient. Who is sick? Who is patient? Sick, this word is very much complicated, as because most of the people, technical people means physician and layman, they consider sick and patient same. But masters, they consider this very word is difference, hell and heaven difference. If you see Hahnemann's one uttering, there are no diseases. No diseases, but sick people. What it is? Sick people, but no diseases. That means sickness is not depending on so-called diseases. Why I am telling so-called diseases? So-called diseases like so many diseases. See, COPD, chronic obstructive pulmonary disease, PCOD, polycystic ovarian disease, Hansen disease, all the so-called diseases are not the disease, please note it down. They are a result of the disease. A result of the disease. What means this disease? The disease is six true disease. That very word, true disease, is mentioned first by James Tyrrell Kent. It is in Kent's philosophy, page number possibly 13. All the miasmatic diseases, again medical term, I must make you clear. I shall try my best to clear all these things. All the miasms are the true diseases. So I use the word true disease instead of miasm. True disease is, what are the true diseases? True diseases are the parents of a result of diseases. That means all the diseases, all the so-called diseases mentioned in the books of medicine, practice of medicine, they are not the disease. Please note it down. They are not a disease. They are only result of the disease. Means the result of six true diseases. A result of six true means real. 6 true real diseases. 6 true real diseases. What are they? Psoriatic miasm, syphilitic miasm, psychotic miasm, tubercular diathesis, post-trauma syndrome, post-rabies syndrome. Again, you please note it down. In classical homeopathy, there is no trace of post-trauma syndrome and post-rabies syndrome. But without having clear idea regarding post-trauma syndrome and post-rabies syndrome, you can't practice homeopathy. That is why most of the homeopaths practice badly with few colored medicine. I am telling you know very clearly that mother tincture, biochemic, steroid, more than one medicine at a time. This practicing is done all over the world by the homeopathy practitioner. I know very well. But someone will claim, I practice only single medicine. But consideration is only patient is considered. But the two masters again and again mention the sick individual. But classical homeopath consider the patient only. That classical homeopath asks the patient, tell me the problem, how it starts, when it aggravates, how it aggravates, how it ameliorates, what food you have desire, what kind of food you have aversion. All these things they ask regarding patient. They consider only patient. All the therapeutic system all over the world consider patient only. Even, I am sorry to say, with due regard, with masters Samuel Hahnemann and James Taylor Kent, they mentioned in philosophy, only with sick individual. But when they have prescribed medicine, when they are treating patient, they behave differently. They practice homeopathy regarding patient. They ask patient regarding their symptom. So, I must tell, with due regards to them, you too have told us what should do, but you have done another thing. That is why, as a real homeopath, I do not obey, I have not taken all the instructions of Sir Hahnemann and Sir Kent. But those very part is with sick individual, I must take it. And I respect them from my heart. But when in lesser writing, if you see the case taking, they have done different things. They asked only regarding question of patient. So, that is why so many classical homeopaths tell me, pass very negative comment about me. But I must tell them, you please read the literature, read the philosophy carefully and seriously. Then you will understand the two masters have told one thing and have done different thing. It should not. As they are our masters, they have done the wrong thing. As because I am practicing only with sick individual, and what I have written, all the literature of real homeopathy, there are no mentioning of regarding patient. I treat the patient. No, I treat the man, not treat the patient, not treat the disease. Classical homeopath, again note it down. Classical homeopath tell, treat the patient, not the disease. But real homeopath tell, treat the man, not the patient, not the disease. That is why all the informations are collected from the sick state, family history, past history, history of present complaint, and philosophy of early life. Philosophy of early life. This very thing, please note it down. The philosophy of early life has not given any importance of any therapeutic system all over the world. Only real homeopath given maximum importance to the philosophy of early life. It is very difficult part for the real homeopath.